As a medical aesthetic doctor, I've noticed that the trend for jawline treatments, augmentation, enhancement has really rapidly risen. Now, this started 2024 and just before that, but it's increasing and increasing. And I think this will be a major trend in 2025. Hi, my name is Dr. Manav Bao. I'm a cosmetic physician in medical aesthetics, and I've been doing this for 8 years now. I'm the medical director of Time Clinic based in Northeast London. And today we're going to talk about jawline treatments and really look at some of the misconceptions, how this works, who we can treat and help with these treatments. So what are non-surgical jawline treatments? Well, these are treatments helping to improve the facial structure, helping with a tighter jawline, helping reduce some of the signs and symptoms of aging. So some of the specific concerns are patients coming in feeling as though they're starting to look saggy, so they present with jowls or a marionette line, or other concerns is they just want to sharpen up that jawline. One of the words that was very common last year and the year before was a snatched jawline. Those are a couple of common reasons why patients really look for jawline treatments. So the difference between treating the jawline and other common areas such as the lips or let's say the cheeks are that we use different types of products in a different way to enhance the jawline. So whether we're treating the jawline directly or we're using different products to create a lift-like effect. And we'll go into the types of products, biostimulation, a little bit later in this video. So why are these treatments popular? Well, patients are now opting for more preventative treatment. So rather than letting things really start to sag down, what we're seeing is a trend where patients are having treatment much earlier to maintain that lift-like effect, maintain a straighter, more youthful jawline much earlier. Now, we would never treat anyone if there wasn't an indication, and we say no to plenty of patients here. But there is a point where actually a little bit of treatment can help maintain this jawline. Social media has really highlighted the need for a perfect jawline. And in reality, too perfect a jawline or too sharp a jawline actually doesn't look so natural. So it's finding that balance between what we see on social media, which, as we know, a lot of the time isn't the truth or the image is enhanced. So finding the balance between that and actually what's realistic for you if you're looking for these treatments, or what we can achieve with the products and treatments that we do have. So what makes this a better choice for patients, let's say opposed to surgery? Well, if surgery isn't an option or it isn't indicated, then non-surgical treatments can work very, very well. Also, a budget comes into play, downtime. So these treatments are cheaper than surgery, but also the downtime is barely anything. So it's minimal. Most patients go straight back to work. But we do have to inform you that there are a few very rare risks such as bruising, redness, swelling, lumps, bumps, and we'll go through this all in a consultation with you. So what does the actual treatment involve? Well, everything starts with an in-depth consultation, images, and discussing whether this treatment may be the right treatment for you. We then move on to treatment planning, where I'll pick different products to use for yourself, and whether it's a case that we start here on the cheek area to create a lift to help with that jawline, or we need to biostimulate the area to again help boost your own collagen and elastin to create that lift, or we use devices to tighten the skin, because all of that will indirectly help with the jawline itself. Now, if you've already got a good jawline and it's just augmentation or enhancing, then potentially we can go directly into the jawline itself just to enhance. Another area that's really important to treat when we're focusing on jawline is the chin. So what we're seeing on social media and patients themselves is when they take a picture from their side or they see a side profile in an image, what they may find is their chin is slightly receding. So their balance or their profile balance is just slightly off. So what we can do is put dermal filler to just enhance the chin, bring it forward ever so slightly. Now, what this does is it balances their profile or your profile, and it also stretches the skin along the jawline, causing a tightening or enhanced effect. So we get the best of both worlds. We improve the balance of the profile, and we enhance the jawline too. So what's the difference in terms of science between dermal filler or harmonica, which is a biostimulator? Well, dermal filler is hyaluronic acid, and when we place that underneath the skin, this will create a lift and then integrate nicely into your own skin and cells. And it really creates a great natural effect. Now, harmonica, which is a biostimulator, that has hyaluronic acid or HA, but it also has calcium hydroxyapatite. Now, the HA is there just to deliver those calcium balls to the skin. And essentially what they do is they stimulate your own collagen, which will give you a hydrated appearance or glow. And it also stimulates elastin, which tightens. So we get an amazing result. And this is going to last 18 to 24 months. Now going back to HA, so we use a product called Juvederm. And when we use that to the cheek or the jawline or the chin, again, we're looking at a good 18 months to 2.5 years for that product to really give you and maintain those results. So it lasts a long time. So how do we ensure that we create safe treatments for you? Well, we train and we train and we train some more. So we're constantly learning. We're teaching both injectors, Dr. Victoria and myself at clinic. We're trainers for national academies. We do a lot of mentoring. And so we ensure that we've got to use the best techniques. We teach them to other clinicians out there. The products we use are the best products on the market in terms of clinical data and safety profile. So for many, many years, they have been there day in, day out, creating great results with minimal side effects. Who are these treatments for? Well, pretty much most patients. You can come in, and if you feel as though you need enhancement of your jawline, you're a young patient, we can directly treat that area. Or if you feel as though things are starting to sag, the skin is a little crepey, again, we can treat you. And it's just using different methods, different products, finding the right bespoke plan for you. Can these treatments address post-weight loss concerns? And we're seeing more and more with weight loss injections that patients are becoming hollow here. But what this has led to is the skin starting to move or sag down. So absolutely these treatments or the combination of these treatments can help. So we can replace some of the volume that you've lost or natural results, but also we can tighten that skin as well. A really common question is, how does it differ between genders? So if you're looking for a more masculine result, there are different techniques or tricks that I will use. Or if you're looking for a more feminine result, again, I would use slightly different treatment products or methods to create that. And just to give you an idea, a very masculine result is a very square shape, very wide jawline. Think about Superman as an example. Or if you're looking for a more feminine result, we've got more of a V or a heart-shaped jawline. So again, I would use different techniques and different placements of different products to create that. So the types of results that you can expect are pretty much instant change. We can see a difference straight away with most of our treatments. If we're using something like harmonica, which is a biostimulator, that takes time to give you that natural enhancement. So we're looking at the best results 6 months down the line. A couple of things that you'll see straight away is an improved symmetry and enhancement of the jawline. So your profile may also be improved if we need to treat the chin. Many patients are worried about looking overfilled, and there's so much in the media about this at the moment. I really want to reassure you that that's something we do not do. We really look for natural results, and we love our patients to go away and their friends and family to say, "Oh, you're looking well. Have you been on holiday?" So we take a step-by-step approach to treatment, and generally we don't do everything in one go, but we'll build upon the last treatment session. And that way we don't overshoot or we don't overfill. We keep those results looking natural for you. People talk about combination treatments, and why would they be better than just single treatments? Well, I tell you, when we treat different parts of the skin with different treatments or devices, that's when you start getting the best results. So let's say, for example, we used dermal filler to help with the volume loss, to create a lift-like effect. We then add on a biostimulator to help tighten the skin. We then start adding on something like laser genesis to enhance the skin itself, so the superficial aspect or the surface of the skin. We've already started to treat maybe 3 different layers of the face. If we were to relax certain muscles that may pull down the corners of the mouth, or there's a treatment called the Nefertiti lift, which is great for the jawline. So again, we're starting to treat all the layers of the face, and they consist of skin, the fat, the muscle, the ligaments, and the bone. So that's when we're really going to get the best results. Now, if we start adding facials such as hydrofacial here in clinic and at-home treatments, so what you're doing day in, day out with your skincare, combining all of that, that's when we see the best results. Aftercare and maintenance. After treatment, we say to all patients, definitely don't do any exercise or vigorous exercise for 24 hours. Avoid alcohol, avoid saunas, because we don't want that increased blood flow to the treatment areas, because that can increase the risk of things like bruising. Don't apply makeup for the rest of the day. We want to reduce the risk of infection. And don't press on the area too hard. Now, sleeping on a pillow is absolutely fine. So you don't need to change the way that you sleep. That's a really common question, by the way. The other point that I would advise is don't have facial massages for a good 2 to 4 weeks to allow the products just to settle in. Maintenance of the treatment, if we're using a product such as Volux or Voluma by Juvederm, then this is going to last you on average 2 years. Harmonica, which is a biostimulator, that's going to last around the 18-month mark. So maintenance is every, let's say, 18 to 24 months, so 1.5 to 2 years. We may add a little bit more. Most patients don't need the whole amount again. It's just adding a little bit here, a little bit there when required. Lower face augmentation treatments are a safe and effective way to really create the jawline that you're looking for. And with the right products, the right patient, the right techniques, we can really create phenomenal results for you. If you agree that there's a big trend towards enhancement of the lower face and the jawline, I'd love for you to hit the like button, comment below. If you've had these treatments or you're interested in these treatments, then again, comment below. I would really, really love to hear from you. Now, if you enjoy these videos, please subscribe. And if you feel that someone that you know may benefit from the information in the video, please do send it across to them. And if they can like and watch as well, it may be helpful.